Hi, my name is Kirsten Schofield, and after reviewing this presentation, you'll better understand how to manage actionable incidental findings. There are no relevant disclosures. We'll briefly discuss the items listed in this slide. An incidental finding, also known as an incidentaloma, is a master lesion found on diagnostic imaging performed for a different reason. Findings that require additional workup are deemed actionable incidental findings. For example, shown here is an incidental pulmonary nodule on a CT performed for shortness of breath. Radiology findings can be categorized as expected versus unexpected. Our focus here is on actionable incidental findings that are non-critical. Most actionable incidental findings result in a diagnosis when a recommended follow-up is completed, including 2 to 4% of cancer diagnoses. Unfortunately, there is evidence that up to a third of radiology recommendations may never be completed. This poses a grave safety risk for patients and providers, which could be devastating if the diagnosis is cancer. 3 major factors drive the increase in completion rates of follow-up recommendation. Providing effective follow-up recommendations, using closed-loop result communication, and leveraging tracking systems help manage follow-up. An effective follow-up recommendation is one that avoids unnecessary testing and costs, and leverages evidence-based guidance when available. Research shows that recommendations that include the lesion, the follow-up modality, and the follow-up timeframe are more likely to be noticed and completed. The second pillar is closed-loop result communication. This type of communication requires confirmation from the message recipient that they received and understood the information, along with proper documentation including the communicating parties, date, time, and mode of communication. Tracking systems are programs where dedicated staff tracks each actionable radiology recommendation to completion. These systems rely on identification of certain phrases used by radiologists that indicate a follow-up recommendation. Staff then periodically review charts and documents which follow-up has been completed, and remind providers and sometimes patients directly if a follow-up is overdue. Tracking systems have proven to be vital in significantly increasing follow-up completion, but there is room for the development of more affordable IT tools that can be integrated into the radiology tracking workflow. Increasing patient engagement within these tracking systems would help to increase compliance in following up on recommended appointments. In conclusion, actionable incidental findings often lead to a diagnosis. Delays in diagnosis or misdiagnoses pose a safety risk to patients that can be addressed by tracking systems that work towards completion of recommended follow-up tests. The use of technology and patient engagement play a significant role in ensuring follow-up recommendations are carried out and completed. Thank you for your time.